Public Health Infrastructure Grant has provided a lot of opportunity to think outside of the box and think through more innovative solutions on how we can get the right people, the right information at the right time to make informed decisions. And one of the primary areas that we were seeing in Utah that could use a little help was streamlining our data sharing agreement process and the way in which our external partners are able to get the data that they need to respond to what is happening in their communities. Rather than trying to create separate data sharing agreements for all of the different state-owned data systems, we're trying a new approach where we've created a shared data environment utilizing our data warehouse that will have all the different data elements that our local partners would need access to, and they can just log into that shared data environment, and then they only need to sign the one data sharing agreement to have access to that sharing environment. So they would be able to pull down the data that is relevant to them in real time. And so we're starting right now with vital records data. That was something that came out from our local health departments as something they needed more immediately, and we're having trouble accessing right now. And so we're going to start with vital records data, and then our next steps would be to start pulling in more data from our Office of the Medical Examiner. So there will be additional data variables that they're not able to get right now through the vital records system, and then we'll move beyond that to immunizations data, and then we'll just continue to grow and expand on that over time as the needs arise. But hopefully this is going to make it a lot easier for our local health departments to get the data that they need. For our local health departments that are trying to respond to something that's happening in their community and they need additional data around that event. So for example, with COVID-19, there were a lot of deaths that were associated with COVID and maybe had some interaction with COVID-19 where maybe they didn't die like within their vital record within that death certificate. Maybe it wasn't COVID-19 that was the cause of death, but it was a contributing factor. And the way that it's set up right now within our Office of the Medical Examiner is you have to manually abstract that information from the narrative. And by having additional variables in our data system for the Office of the Medical Examiner, we can better pull that information out and have a more robust response for the community on what's contributing to that death. The length of time that it's been taking to get a data sharing agreement in place, they were taking up to 6 months, 8 months. Going with this process, with this data sharing agreement, with the shared data environment, we won't really need to go through those negotiations as much. And so you'll have access to your data faster. And then maybe if you need more granular data or if you need more specific data for your community, then we can go into those negotiations on a case-by-case basis, but you're not holding up the entire process for your full sharing agreement going through those negotiations. But just having that streamlined process of being able to have data faster is huge for being able to respond appropriately to whatever that need may be in your community. And our hallmark and what we've been doing under data modernization in Utah is that the right people have the right information at the right time to make informed decisions for the health of their community. So in the case of measles response, having a better sense of what your coverage is in your community and where your lower vaccination rate pockets are gives you an opportunity to do targeted intervention in that community, increasing vaccine rates or increasing education around vaccines, or how you can be proactive in preventing measles from entering your community when we know that it's around the community in this other area and it's starting to increase. We can then target, okay, well, this area also has really low vaccination rates, so we can use our community health workers, partner with a community-based organization, and do education and targeted outreach.